Good afternoon. Joe McComb, Mayor of Corpus Christi. We want to continue our information briefings to keep you updated on the status of how we are in the COVID fight. And I want to thank you for participating and keeping your masks on and washing your hands and doing things. I think we're making great strides. I have not seen the numbers today, so I'm hoping that they're going to be either equal or less than they were yesterday. I don't know. But whatever they are, we're going to deal with it. And we just want to continue to encourage those of you that are out there to abide by the rules and regulations and the recommendations, because we're doing it for your safety. Again, I want to say a word of thanks to the medical profession that continues on a day-to-day basis without wavering and without giving up. And I see them periodically and thank them as much as I can. I'm not sure we can thank them enough, but I thank them every time we get a chance. And so to try to keep the briefing brief, I'd ask City Manager Peter Zanoni to come up and give us today's statistics and the information that we have. And then Judge Canales and Annette Rodriguez will be bringing you the information that they have for you. So to move the briefing along, Mr. Zanoni, you ready?
Primeramente, le quiero agradecer a los residentes por continuar participando y siguiendo las reglas para así aminorar las cifras por el virus. También quiero agradecer a la comunidad médica por todo su trabajo hasta el día de hoy. A continuación va a hablar el administrador de la ciudad, Peter Zanoni.
Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and I'm going to provide the statistics for the day. This includes number of new cases, percentage of persons recovered, and we'll talk about hospitalizations and then also number of deaths. All right, so on this first chart here, we're going to see the number of new cases reporting for today. That's 230 additional new cases, persons that have been diagnosed to have the COVID-19 virus. It's down 29 cases from the total number of cases yesterday, which is 259. So there were 259 confirmed yesterday. Today, an additional 230, and that's 29 less per day than yesterday. When you look at the graph, and we're going to analyze this a little bit more for tomorrow's presentation, but if you take out that 502 number on July 22nd, it kind of eyeball looks like around 200 cases a day, and our 7-day average is 222. So we've been kind of stuck in that 200 range. And tomorrow also, Dr. Bird will be here from Texas A&M. So what we need to try to figure out is the interventions that we have in place, to include restricting access to our beaches and keeping the bars closed and encouraging face masks, social distancing. Is that going to help us get below that 200 number? That's the question that we're going to have, and hopefully we'll have an answer by tomorrow. So you can see the trend line there. Let's look at the next chart, which is the recovery versus active cases. We're doing better here as days progress. That big number from about 2 weeks ago, those persons are beginning to recover past the 14-day period. So today, 36% of all COVID cases are in a recovered status. So a little over 4,000 people, 4,071. And then 64% of all the cases are active. So the 7,100 active COVID cases. And then you can see in the chart, the yellow slice, 166 deaths, and that's 4 more since yesterday. We'll talk a little bit more about that in a separate chart. Okay, and as the mayor said, the number of hospitalized persons is getting less. Today, there's 10 fewer in the hospital than yesterday. So we had 397 in the hospital yesterday. Today, it's 387. persons in the hospital recovering from COVID-19. And then of that number, 144 are in ICU, intensive care, needing more treatment, and their conditions is more serious than others. So that number's been somewhat consistent over the past at least week and a half. It's 3 fewer than yesterday's 147, but 144 today. And then the number of deaths is 166 in total since we've counted going back to April. And in the last day, there's been 4 additional deaths that we have to report to the community, which is bad. It's a bad thing, but it's about half the number that we have been reporting over the past couple of days. It's been in the 7 and 8 numbers each day. I think today's 4 is one of the lower numbers we've seen in some time in terms of number of new deaths. And then this final graph shows our daily count, and that also has a red line that shows the 7-day running total, or running average, I mean. And you can see, and Dr. Bird will talk more about it tomorrow, it looks like we may have peaked around this point, and the peak is coming down, but we're still, as we talked about, kind of stuck in that 200 range. So we need to figure out how we're going to get lower and lower, less than 200, less than 100, and so on. So the 7-day daily average is 204 cases, 204. Yesterday, I think it was 222, so a little bit better there on the 7-day average. Okay, that concludes it on the statistics. I think the next person is Judge Canales is going to come up next, and in the meantime, Gabby is going to translate into Spanish for the audience. Thank you.
En las últimas 24 horas se han reportado 230 casos confirmados por el coronavirus. 4.071 pacientes se han recuperado por completo, 387 personas continúan en el hospital, 144 están en la unidad de cuidados intensivos, 7.153 son casos aún activos. El día de hoy se reportan 4 fallecimientos. A la fecha, los fallecimientos totalizan 166 personas.
Good afternoon, everybody. Barbara Canales, Nueces County Judge. Well, a little less than 2 weeks ago, I came here to this very podium and I announced that a beach order to prohibit vehicular access to our Gulf beaches would be signed by myself in order to slow the spread of the coronavirus. And I said at that time the beach order was my order. I made it in consultation with city leaders and with the cooperation of our state and federal partners, as well as judges from other coastal counties. In the time since that order, we have endured Hurricane Hannah, and we've seen one of the most treasured, iconic attractions, Bob Hall Pier, severely damaged by the hurricane, along with damage throughout Nueces County. The best news, however, of the last 2 weeks was that we had no loss of life and no serious injuries reported due to the hurricane. And I believe that that is due in part because the vast majority of you took no unnecessary risks. You stayed off the roads, you stayed off the water, and you stayed off the beaches where there was tremendous surge and the power of the force we have seen in the destruction of the island and some of its infrastructure. We did almost have a near tragedy, however, and there was a boat with 3 adults. Many of you may have seen this in the news. 2 of them were in their 80s and one was in their 30s, and they were in terrible distress during the storm and they were sinking. And on Tuesday, Governor Abbott honored the volunteers from Texas Task Force 1 who risked their lives to save them, and I got to be in the room, and gratefully I also got to pay our thanks on behalf of Nueces County. I'm so grateful that we have such amazing heroes that live in Texas and that come to our community in times of difficulty. But I also really think about the lives that were put in jeopardy, their lives, because there was unnecessary risk taking as a hurricane taken. And so taking unnecessary risk doesn't just put those in the boat at risk, in our boat example, or those on roads or beaches, but it puts our emergency first responders at risk. And the same, I think, can be said for all the measures we've put in place to slow the spread of the coronavirus. So I'd like to focus on that, this need for not taking unnecessary risks. For example, wearing a mask isn't just for your protection, it's there to protect others, because you might have the virus and not know it, but you could be spreading it to others. Of course, maintaining social distance isn't just for your protection, it's for people that are around you as well, so we can keep them safe. And of course, the large gatherings, parties, that measure is put into place to reduce to 10 or under, because it's meant to keep you and your friends safe as well. But it also helps all those folks that they encounter after they leave that reunion or that gathering. And so it is with vehicle access restriction to our beaches. And you will know that, might remember that I always like to ask rhetorical questions because I feel like I'm having a conversation with you. You know, I come here almost every day of the week and I've gotten accustomed to looking in a camera, but somewhere I know that you're watching and we're talking as if we were in the same room. And so I ask us together, rhetorically, why are we making these orders live longer than necessary? And I said 2 weeks ago that we were at a tipping point in our hospitals and our ICU capacity, and that we were at a breaking point with sufficient medical staff and medical supplies. And I need you to know that as much as it pleases me that we see this dip coming down, today I had the opportunity to visit with the CEO of one of our hospitals. I was there with the CMO, the Chief Medical Officer, and many of the staff. We are still in crisis. And so it is very important that we have continued our work to add capacity in our hospitals. And things are still really constrained. They again renewed their request and their urgency to me as the judge to make sure that we could get adequate staff to stay the course. So I want to address the vehicular access order, which I will be extending tomorrow for 2 more weeks, as not a part of government overreach, but as an important aspect to protect the general welfare. 2 weeks ago, when I came before you, we were number one in counties in America with COVID-19 cases per capita. And I told you that this number was obtained by the numbers of positive cases in our population, and that we were number 2 for deaths in our state per capita. And a very fair question for you to ask is, have we seen our numbers respond to the actions that we've taken together? The mask wearing, the vehicular beach restriction, is that making a difference? Have we seen our numbers respond because of the actions that were taken? Here's your answer. I wish Peter had that graph up again. We have. We may or may not have reached our true plateau, but we have bent this curve, and it's not by accident. Now, we cannot be 100% sure of anything in this life, but what we can attribute part of the change to is definitely masks, definitely the beach order, and definitely the measures we have taken as a community to make certain that none of us are taking the unnecessary risks, not just for us, but for everybody else around us as well. And what we know are these facts: that Easter weekend, we had a beach order in place, and we didn't have a spike until Memorial Day weekend, when we had no beach order, when we had a tremendous spike after Memorial Day. July 4th, we started again through now the mid-July process. And now this beach order that's been in place the last 2 weeks, I can honestly say that our numbers are responding. So here's the deal. We can't stop now. We're not at that point yet. But I have consulted with Director Rodriguez and the city manager and the mayor, and I will tell you that it's really, I think I wouldn't be human if I didn't say that it affects me every day that we make these announcements regarding our cases, our hospitalizations, and our deaths. I know that there's people behind those numbers. They're my friends. They're your friends. They're my neighbors. They're your neighbors. They're our colleagues, our relatives, and some of them are even our own loved ones. The best predictive data from Texas A&M says that if we keep doing what we're doing, then maybe the worst will be over for the summer, at least for now, for this spike, for this weird wave of the first wave. But that's all if we keep doing what we are doing. And this means that we've got to make certain that some of these orders stay in place until we get the results that we want, that we deserve, and quite frankly, that will save lives. I've always said that the data will drive the decisions. And I've set this order through August 17th. I was trying to make it a perfect 2 weeks, but it turns out that 17th is on a Monday, so it worked out well to give the date the 17th, and I'll sign that order tomorrow morning. And between now and then, between now and the 17th, we, the collective we, health experts and elected officials, will be examining the data to see what is working and what is not working. It'll be my lookout point. And I want you to know that we're, in the meantime, working right now. That's why I was with those CEOs. We're working right now to build more capacity in our community to care for patients. We're working right now to expand testing even greater than what we're already doing, and better diagnostics, faster diagnostics to identify who might have symptoms even if they don't feel sick. We're working with things like temperature checks while you get tested and blood oxygen saturation levels when you get tested. I know nobody wants to hear about restrictions, and nobody likes having restrictions in place. And you might even say to me, I'm willing. I had someone come and tell me yesterday, a physician, that they're willing to accept the risk of going and doing whatever they want to do by not adhering to the gathering rules, not adhering to the masks, not adhering to the beach orders. And it kind of reminds me of that person that was out there in distress on that boat that needed Texas Task Force 1 to come and rescue them. Sometimes the risks we take affect others. Sometimes the risks we take affect others and cause them their lives. It's not about you. It's not just about you. Those risks mean that healthcare workers like the ones that I met today, who are so brave and so dedicated and so committed, that they're looking to you to minimize those risks so they too can go home to their family and not have to worry. They're already taking care of so many. So just like I said for Hurricane Hannah, we will have plenty of people having accidents that are unavoidable. And we're going to have plenty of people that catch this disease despite all their good measures. I know that. It seems unjust, almost unfair. But there is something called an unforced error in sports. It's taking an unnecessary risk that causes that fumble, or that ball in the net, or that ball to be overthrown that costs you the game. Let's not make it any worse by taking unnecessary risks. I'm proud of us. I'm proud of you. I'm proud of our entire team because we've driven the number down. But I mentioned today in my own home that the coast is still not clear. Let me say that again. The coast is still not clear. And I have restricted and intend to extend vehicular access restriction to our beaches to reduce the number of people on the beach. But make no mistake, I'm not preventing you from going to the beach. It is your water. It is your beach. It does belong to Texas. I know that. about 50 years ago, my grandmother fought for that, taught me that lesson. But the point is that right now we do need to reduce the numbers out there so that in here, in these press briefings, when I reveal the numbers to you, or Manager Zanoni does, that you see them going down, down, down. Remember our mantra, worst to first? So these measures are for the protection of our community, and you can do your part. And I know you know what that means. So I would ask you to please allow us to keep winning together. And I also know that outdoors is good for us. I know that swimming and surfing and windsurfing and kite surfing and all of those things are part of our wellness. And I don't want you to stop. But what I do want to do is drive this virus out of town. So let's keep doing what we're doing. This, it's not a guess. This is working. And we need to keep it up. And the other thing that's working is vehicular access restriction is working. And we're still able to enjoy the beach in the way that it was meant to be enjoyed during a pandemic. Carefully, with some restrictions for the benefit of the general welfare. And please remember that due to Hurricane Hannah, there is a small stretch of beach that's still unsafe, but we have teams that have been mobilized from the General Land Office to begin beach debris removal. And the county will also be deploying certain engineers to work on structural integrity. And my goal is simple. Get us back to healthy, get us back to fishing on that pier, eating at Michael Mays, enjoying everything that we love out there as soon as possible. Tomorrow there'll be a special commission meeting, and in that special commission meeting, we will address the extension of our local disaster. This is required under law. I do the first one in my emergency manager capacity. Then the second one we do is after 7 days, it's done by Commissioner's Court. I look forward to seeing you, maybe joining us by WebEx or the other profiles that we have, platforms, Facebook, YouTube, etc., CCTV, at 10 a.m. tomorrow morning. It'll be short, it'll be sweet, but it will be impactful. It means we can get public assistance and the resources we need here in our county to rebuild. Thank you so much. And again, I hope to bring better news on the other side.
Hace menos de 2 semanas anuncié el cierre de las playas para los vehículos. Mientras eso sucedía, tuvimos el paso de Hannah. La buena noticia es que no se reportaron fallecimientos. Los residentes hicieron caso de esa orden y estuvieron fuera de las playas. Solo se reportó un bote, el cual casi se hunde, pero gracias a un equipo especial, esas personas no perdieron la vida. Asimismo, he hablado de no tener riesgos no necesarios, como el uso de cubrebocas para evitar contagios. Lo mismo con las reuniones con grandes grupos de gente. Lo mismo sucede con la orden para restringir el acceso vehicular a las playas. La orden se tomó ya que estábamos en un punto donde llegábamos al tope en hospitalizaciones y la capacidad con médicos y camas en hospitales. La situación, aunque ha mejorado, aún no es aceptable, por lo que quiero retomar la orden de restricción de acceso vehicular a las playas, la cual voy a extender el día de mañana por 2 semanas adicionales. Usted se preguntará si las acciones que hemos tomado, como el uso de cubrebocas y el distanciamiento social, han ayudado, y la respuesta es sí. Sí ha ayudado a reducir las cifras. Cada vez que una orden estaba vigente, ayudó a que las cifras bajaran, y cuando no hubo una orden durante el Día de los Caídos, por ejemplo, las cifras se dispararon. El estudio realizado por Texas A&M es que las intervenciones no farmacéuticas van a ayudar a terminar con estas cifras y así salvar vidas. La orden de restricción va a estar vigente hasta el 17 de agosto. Todas las órdenes que siga tomando estarán basadas en los datos que estemos recibiendo. Vamos a continuar realizando la toma de especímenes y mejorar los tiempos de diagnósticos. Hay personas que me han dicho que no les importa arriesgarse, pero tomar esos riesgos afecta a otras personas, no solo a la persona que está tomando ese riesgo. Me da gusto por ustedes y sobre todo por los oficiales que han tomado acciones, ya que estas acciones han funcionado. El día de mañana también tendremos una junta especial con los comisionados para revisar nuestras órdenes por emergencia. La junta será a las 10 y la podrá ver mediante varios medios.
Annette Rodriguez, Public Health Director. First, I want to extend my condolences to the 4 that lost their lives today to the COVID battle. Then I want to give you a brief update on our drive-through this morning. So we did have our drive-through. We actually scheduled 206 individuals to come through. 106 people showed up, and there were 35 positives out of 106. So it gave us a total of a 33% positive rate for our drive-through this morning. So we can all agree, as everyone has heard today, that COVID-19 has changed our lives dramatically. One of the biggest challenges facing our community is the reopening of schools. On July 16th, 2020, Dr. Ram, our local health authority, issued an order for all independent school districts in Nueces County to delay on-campus instruction until after September 7th. This order was done in the best interest of saving lives in our community. No one wants to send their student to school and they end up coming back home and getting somebody positive from being exposed at the school. Nobody wants to send their student to school and they come back and they have no symptoms, but they spread this virus to elderly parents or elderly grandparents or infants under the age of 1 or other vulnerable populations in their families. Our ISDs all agreed with the public health recommendations to delay face-to-face instruction until after Labor Day. Due to the current climate, plus also the increased number of COVID cases in our community. While students will begin school virtually, the Texas Education Agency is still mandating vaccination requirements be met. Therefore, the current requirements are that all students must be up to date on their vaccinations in order to attend school for the 2020-2021 school year, whether virtually or on campus. It's very important. In order to help these families facilitate getting their vaccines, the health district is setting up several drive-through events. So it's just going to be like the drive-throughs for the COVID swabbing, but it's going to be a drive-through for the vaccines. We've done this in the past. And these drive-through dates are as follows. So on August 5th, we will be at Banquetti High School from 2 to 4 p.m. On August the 6th, the health district will be at the Calallen High School from 2 to 4 p.m. On August 8th, we will be at the Ray High School from 10 in the morning till 2 p.m. And on August 17th, we will be at Port Aransas High School from 2 to 4 p.m. For more information on vaccine eligibility requirements, call the immunization clinic at the health district. The number is 361-826-7238. While getting ready for back to school, remember to stay COVID-19 ready. What does that mean? That means ready to wear your mask when shopping for school supplies. That means ready to keep your 6-foot distance in those school aisles, or better yet, ready to shop online for school supplies. Let's all be ready to do our part to stop the virus. Stay ready, stay well, and as always, stay informed. Thank you.
Quiero empezar con mi sentido pésame a las familias de las 4 personas que fallecieron hoy. 200 personas estaban inscritas en la toma de especímenes móvil y 106 acudieron. De estas, tuvimos 35 positivos, es una tasa positiva del 33%. Uno de los retos durante esta pandemia es la reapertura de las escuelas. El 16 de julio del 2020, el Dr. Ram, nuestra autoridad de salud local, emitió una orden para todos los distritos escolares independientes en el condado de Nueces para retrasar la instrucción en persona hasta después del 7 de septiembre del 2020. Esta orden se dictó en el mejor interés para salvar vidas en nuestra comunidad. Nadie quiere enviar a su hijo a la escuela y causar un contagio. Tampoco nadie quiere que un estudiante regrese a casa con el virus, pero sin mostrar ningún síntoma y capaz de propagarse a padres, ancianos, abuelos, bebés o otras poblaciones vulnerables en su hogar. Los distritos escolares independientes de nuestra área estuvieron de acuerdo con la recomendación de salud pública para retrasar la instrucción en persona hasta después del 7 de septiembre del 2020. Y aunque esa instrucción en las aulas comenzará hasta septiembre, los requisitos por parte de la Agencia Estatal de Educación relacionados a la vacunación son los mismos. El requisito actual es que todos los estudiantes deben estar al día con sus vacunas para poder asistir a la escuela durante el año escolar 2020-2021, ya sea virtualmente o en persona. Con el fin de ayudar a las familias a preparar a sus hijos para la escuela con la vacuna, el Distrito de Salud tendrá varias clínicas de salud móvil para vacunar a los estudiantes. El 5 de agosto en la preparatoria de Banquete de 2 a 4 de la tarde. El 6 de agosto la preparatoria de Calallen de 2 a 4 de la tarde. El 8 de agosto en la preparatoria Rey de 10 a 2 de la tarde. El 17 de agosto en la preparatoria de Port Aransas de 2 a 4 de la tarde. Para obtener más información sobre los requisitos de elegibilidad para la vacuna, puede llamar a la clínica de vacunación al 361-826-7238.
Thank you. Well, that concludes the briefing. The judge and the city manager and myself are here. Annette, I'm not sure whether she is available for questions, but if you have any questions, if not, that'll get us closed up. Or did you have a question? For the judge? Calling the judge.
I wanted to ask if you had any updates on the COVID clinic.
Oh, yeah. There's always so many good things to talk about. I didn't want to overdo it today, but thanks for asking. We've been working really hard on the COVID clinic. And so let me kind of see how I can try to summarize. So the best news, I think, is that in the next few weeks, it will be open. We're going to actually do what we think is a run-through with no COVID patients, just regular patients to test our systems. In other words, we want to actually test how the online system will work for you looking for an appointment, and that getting you to a nurse and having them talk to you, and possibly, testing our telehealth as well, links. And then, of course, just running the whole course of, does the building look sound and safe, right, from a COVID-19 perspective? So we've worked very hard to put integrated technology in the clinic. That means we've been getting Wi-Fi ready this week. We've got laptops and printers and scanners, things that are needed for the medical professionals to be able to, function. We've also gone through great lengths with signage inside and outside, so we can have doctors and healthcare professionals entering one way and patients another. I think it's going very well. I mean, I hate to say which date it's going to start, but like I said, this weekend we're kind of doing our own little protocols, and maybe by next week we can actually start seeing patients. But I kind of set a date of August 10 in my brain so that I could beat it. I want to beat August 10th, but that was the day that we set aside. But look, this is an amazing collaboration between Amistad Wellness Clinic, the City County Health Department, and then City EOC and County EOC. And the reason I mention that is because it takes us all working in tandem to get a clinic up. I met somebody today who has been working in pandemics for the last 25 years. He was a physician. And he said something really interesting to me that I think you might find interesting too. And that is that I told him about the clinic, and he says, boy, that's great. He said, it would be wonderful to think that just this, and we pointed to our masks, would be enough. Or it would be great if it was just thinking that if I just got enough hospital beds. But the truth is, he said, is that we need everything, because we're going to be living with this disease for a while. And in order to really get your community under control and suppress this virus, you need things like an isolation unit, a COVID clinic, surge capacities, alternate care sites, all of these things. It's not one thing. And you build it so that when the surge happens, the next spike, you're better suited to handle it. And it's really no different than the way we deal with hurricanes or any other disaster. Once you've gone through it, then you know how to build for it again, and you build strong. And he thinks the COVID clinic is an example of building strong. So I'm excited about it. Again, it's only going to be for people who are COVID-19 positive, and it will be available to those doctors that have patients that need to be, brought to the clinic. It'll be available if you don't have a doctor. And I do want to emphasize that it will be at no cost. If you have insurance, there won't be a copay, but your insurance will be billed. Does that help you, Courtney? Give you an overview?
I have like just a few
Sure.
follow-ups. One would be like, how would patients be referred to the clinic?
Good question. So you could be referred from an urgent care clinic after you tested positive. You could be referred by a hospital because you've come to the emergency room, but perhaps you don't need to be hospitalized, but maybe you're a person that they'd like to monitor or get evaluated. You could also just be a citizen that says, I've just got tested, but I don't have a primary care physician. I have a question. I want to see somebody. Those are the three main avenues: doctors, hospitals, and I guess hospitals/clinics, and then just the private person. So there'll be a portal, like a website, that'll be open for you to be able to sign up, and it will direct you, after you fill out some information, to a call center. And a real nurse will answer. And that nurse is trained in COVID-19, and they'll be able to say, I'm going to set you up with a link for a telehealth visit. And you'll be able to talk to your doctor over that telephone. Or they might say, I think your symptoms are a little heightened, and I'm going to set you up for a clinic visit. Or they may say, sounds like you're asymptomatic, but let me answer your question about going back to work. Let me answer your question about being with your family. That type of thing. So there'll be different paths to take depending on the COVID-19 positive patient.
And the last question about it would be staffing. Just who would be staffing? and
Right.
how
So
would
the staffing is coming mainly from Amistad Clinic, from the medical side, but there's also doctors that are volunteering their time and nurses that are volunteering their time. I have put a STAR request in. That's the way that we send up requests to the state to say, please send us some additional staffing. It could be anything from somebody who receives, like kind of think about it as a reception area, all the way to a technician. We will be able to do x-rays on site, mobile, and we will be able to refer patients to, we will be able to issue prescriptions as well. So there's going to be a need for, I would say, staff to help us fill those prescriptions, because we don't want the COVID-19 patient going to the pharmacy, and we'll need technicians. And something you might think is also interesting is that we're looking for people to staff this who have already had COVID-19 and recovered, thereby lessening the heightened viral exposure to those folks. Thank you.
Any other questions? All right, well, thank you. That concludes today's briefing, and I guess tomorrow we have the A&M report, and it's at 3 o'clock tomorrow. So we'll see you then. Thank you.